Very good morning, respected everyone. Today I am going to give a talk on the paper, a study of contrast sensitivity in eyes with hydrophobic and hydrophilic acrylic foldable posterior chamber intraocular lens. And there are no financial interests or relationship to disclose in the as a part of my study. Coming to introduction, the cataract extraction techniques have evolved over the years. However, despite a successful cataract surgery and there are with adequate refraction, the patients are usually complaining of visual side effects. The quality of the vision is lost even though the quantity remains the same. So contrast sensitivity may be decreased following cataract surgery and IOL implantation. So which can be influenced as literature told by optic design, dimensions and optical qualities of IOL. But before going to the contrast sensitivity proper, we have to know what is contrast. Contrast is defined as a degree of blackness to the whiteness, and the contrast threshold is the minimum contrast we have to require to perceive an object clearly against a dark or bright background. So contrast sensitivity is the ability to perceive sharp and clear outlines. A patient can have 20/20 or 6/6 vision and still they have loss of contrast sensitivity, which is psychologically disturbing to the patient. So my need for this study is to usually we do Snellen's chart with very high contrast sensitivity in our OPDs, but in real life scenarios, the patient won't be able to encounter that high contrast background. So that is my need for surgery this study. And aim of the study is to evaluate the effect of IOL on contrast sensitivity function in patients following phacoemulsification surgery. And my objectives, I will compare the effect of foldable aspheric, hydrophilic and hydrophobic acrylic lenses on contrast sensitivity function after uneventful phaco surgery, and we will compare the contrast sensitivity in patient before and after the surgery. And this is a type of analytical observational study done for 3 months in a period of 3 months with a total of 50 patients. We divided the patients into two groups. Group 1 which receives hydrophilic aspheric PCIOL, whereas in group 2 they receive hydrophobic aspheric PCIOL. And we included a specific category of patients into this inclusion criteria. We will take the patients who have grade 2 to grade 3 nuclear sclerosis and who underwent uneventful phacoemulsification, and the IOL is placed in the bag IOL with post-operative vision more than or equal to 6/9. We will exclude the patient who is having brown cataract and grade 4 and above nuclear sclerosis, and the patients who have lost contrast sensitivity due to degenerative conditions of the macula and other ocular pathologies, and the patients who already have and previous ocular surgeries other than cataract, and the patients who have uncontrolled diabetes mellitus. And all these surgeries are done by a single surgeon, and the pre-operative and post-operative evaluation by a single technician who was blinded for this study. And visual acuity with Snellen test was done pre-operatively, and contrast sensitivity function here in this study we measured using Pelley-Robson contrast sensitivity chart, and we did corneal curvatures, intraocular pressure, anterior segment examination, dilated fundus, and B scan, A scan and IOL power calculation. And post-operatively the contrast sensitivity with best spectacle correction was done at the 4th week, which shows the early post-operative increase in contrast sensitivity is there or not. And for intergroup comparison we did independent sample, and with intragroup we done paired t-test. And pre-operatively and post-operatively there is an increase in the mean of the contrast sensitivity in logmar units, and the p-value is very significant. In the pre-operative and post-operative hydrophilic groups as well as hydrophobic groups, there is a significant improvement in the contrast sensitivity with significant p-value. But intergroup comparison with hydrophilic and hydrophobic acrylic lenses show no significant correlation, significant difference between them. And coming to discussion, cataract surgery improves the contrast sensitivity. There is a term, there are optical qualities like AB numbers which will depend on which is a measure of chromatic dispersion of the IOL, and the hydrophobic IOLs have lower AB numbers, so they have more amount of chromatic dispersion and larger amount of chromatic aberration. And hygroscopy is one term which is another optical property. This, if the hygroscopy is less, then the fluid will collect in microvacuoles which will cause glistenings, and these glistenings are thought to impair the contrast sensitivity function. And also there is a lower amount of grade with hydrophilic IOLs when compared to hydrophobic IOLs. But this study shows that even with chromatic dispersion, glare divisibility and glistenings, there is no effect on contrast sensitivity function. And regardless of the material of IOL, the contrast sensitivity increases. Similar studies like by Anthony Chang and Akman et al. Also infer the same results, that contrast sensitivity is not dependent on the material of IOL and the optical properties of the lens. And My limitation of the study is more sophisticated measure other than Pillai-Robson chart are available. We are not used as for the resources available, and we conclude that cataract surgery improves the contrast sensitivity regardless of the material of IOL, and there is no impact of optical properties of IOL on the contrast sensitivity function. These are my references. Thank you, sir. No.
Color also.
So usually contrast sensitivity is we have to differentiate the background against. So maybe in other cases, but usually the contrast we experience in the daytime and in the is of white background and of gray background. So we will technically implicate that in the contrast sensitivity function.
This Pillai-Robson is only a subjective way of assessment of contrast sensitivity. What is the objective way you can assess contrast sensitivity? Any objective instruments we have to assess the contrast sensitivity?
Actually, contrast sensitivity can be measured by two types of measurements are there. There are letter charts and there are some sinusoidal and space wave
Sine wave gradings.
gradings
Okay.
are there.
Yes.
So and some visually evoked potential through that also we will measure the contrast sensitivity, which is usually
Those are all only subjective. You will be asking the patient. Objectively, if you want to know the contrast sensitivity, any instruments you know where we can objectively assess contrast sensitivity? There are abrometers, we have eye trace, okay, abrometries, where we can directly measure, objectively we can measure the contrast sensitivity in cycles per second. Okay.